That's okay, good. Good afternoon, everybody. My name is Dr. Michael Palmieri. I am the research director at Dominate Your Game in Las Vegas. We run the event here at the Olympia called Olympia University. It is a seminar series right outside the main door. It's a room right outside here. We have seminars and workshops, speakers, and we cover a whole bunch of different topics relating to the industry, from nutrition and training to hormone therapy to rehabilitation, a whole bunch of different stuff. We got great experts on board. Here are three of our speakers that we have inside the seminars. I'm going to let them introduce themselves, and then basically we're just going to do a round table. We'll bring up some points, some questions. If we have time, we have about 45 minutes. We'll take some questions from you guys and then go from there. So start with Dr. Fete.
Hey guys, Dr. Eric Fete. I'm the fitness physician. I'm in Ohio, and I do telemedicine across the country. I do health and performance optimization, hormone therapy, peptide therapy, anti-aging, and I do what I practice muscle medicine, talking about the importance of muscle as an endocrine organ, how it can prolong your life, help you live stronger, better, healthier. So I do hormonal fitness. I go hormone therapy by kind of take it to the next level with precision cellular medicine, genetics, laboratory evaluations, and again I do telemedicine all across the country. So I look forward to contributing, and hopefully everyone's having a good time.
Awesome. My name is Dr. Thomas O'Connor. I'm an internal medicine doctor, also known underground as the anabolic doc. When I come to these kind of places, I do have a good time. So essentially I've created a subdivision of internal medicine called testosteronology, and caring for men that are on androgens is something that I've always been very interested in, because I myself have been on androgens for many decades, and I realized that there was a deficiency of care from traditional medical doctors. So I decided to focus on that, and here I am. So everything I do really is focused on caring for men that are on androgens, some of them too many androgens. You can kind of look around, but we're not going to talk about that right here. We'll talk about the elephant in the room to my left and right, but the reality is it's getting bigger and bigger and bigger, and I want people to understand the risks of androgens, from even a little bit of androgen, testosterone replacement, all the way through to a spectrum of performance-enhancing drugs, which has become very common and very complicated. So that is really my full-time job. Thank you so much.
Hello, my name is Touliatos. I come from Greece, known as Dr. T or as Dr. Testosterone. This is my second Olympia University. I'm the medical associate of Anabolics Group and Muscle Development Magazine. I'm Dr. Thomas O'Connor. My main field is biopathology, to analyze blood work regarding harm reduction in anabolic steroid use, but also replacement therapy in men. I've been presenting in several websites. I'm thankful to Michael Palmieri for his invitation this year as well. I hope we have a good seminar.
All right, guys, thank you very much. So we're going to just jump on into it. One of the things I'd like to kind of dive into right now is, obviously with the expo and everything that's going on here with the Olympia, there's a lot of supplements and nutritional products and stuff like that. So I want to kind of take, we'll start off with that, since everybody here is probably doing some sort of supplement, that's why they're here. So I want to dive into that and say, what do you guys think of certain products, like say caffeine use or creatine or some, certain other supplements or certain products that you guys have experience with? Or particularly in your practice with maybe helping your patients?
Yeah, for sure. It's a big question, and we could probably all each talk for an hour about supplements.
Oh yeah, at least.
Again, there's a million of them out there you can pick from. For me, my focus is really trying to simplifying it down for my clients, because there's so much information out there. It's information overload. So I really try to treat it more on an individual basis. What do you need for your clinical situation? What's your goal? What are you trying to achieve? And sometimes I'll do some not only blood work, but looking at tests to see at your intracellular health, because there's a lot of tests you can look at levels in the blood, but they don't tell you what's in your cell. You can say you have good B12 vitamin levels, but in the cell it's not getting in. So you do this specific test and it'll clue you in. Same with like epigenetic tests, gut health microbiome tests. You could really dial in exactly what the person needs. So then I try to tailor my strategy for that. So I can kind of take it up a little higher on the specificity and give them exactly what they need. That being said, if someone's on a budget and they don't want to do these tests, I try to keep it as simple as possible. In our modern world, our soil is very depleted of minerals and nutrients. Our food is, unless you're spending a lot of money, it's very hard to get everything you need. So pretty much everyone is deficient in things like magnesium, vitamin D, vitamin K. Those are some big ones. Oftentimes B vitamin complexes. And unless they're eating a lot of fish, they need some omega-3s. And those are kind of the top ones I really focus on. There's a ton more that we could do, but those things do so many things for the body right there. In terms of performance supplementation, I think, again, keeping it simple, everybody of course knows about protein, right? But you want to get a good brand. And sometimes I still think it's best to get it from food, but sometimes people need a shake or a whey protein supplement. Creatine is probably the most well-studied supplement out there, very safe, not only just for performance, but for benefits on the brain, which is newly becoming aware of. A lot of people are getting more aware of that. So, again, I think if you just do a base of that, I think you're pretty well covered.
Thank you.
Right, so I agree with Eric's a physician. So, when we were trained in medical school, we don't learn anything about dietary supplements, all these kind of things. Kind of learn this after medical school. I think it's not really a shortfall of physicians so much, but I think physicians have to learn a lot, and now there's less and less time to do it because it's a microcosm, right? I mean, there's 7 types of cardiology doctors now, right? There's 5 doctors for the eye. I mean, so it's so focused and specific now that nutrition is such a big thing, and supplements. So I want people to understand when you're looking at health, as I'm a primary care doctor in my training, health starts off with behavior. Your behavior. So changing your behavior so you eat properly and you get good food intake and that you're doing well, you're getting exercise. That's always number 1, right? So it's diet, behavior, changes. Now you can see in the world that we have obesity epidemic and we have medicines that are not supplements, right? That are semaglutide, GLP-1 agonists, sodium glucose co-transporters. I mean, this is the stuff that I focus on. It's semaglutide, right? It's Ozempic and Mounjaro. And for people that are suffering with obesity, these are medicines that are really going to help, but there's going to be side effects. And in the end, it's behavior. So behavior is number 1. And I think if you come here, you see people that are all ages, that are in great shape, with or without testosterone or steroids, they have their behavior down. Next, after behavior with diet and exercise, you have supplements. The supplements in the world of supplements is really kind of interesting, right? So there's a gray area, right? Yesterday we talked about in New York State, they're putting a limit legally that I think 18, if you're under 18, you can't buy creatine supplements for children. And I don't know where that's going to end up. Creatine is good, right? Typically. Can creatine cause problems? Well, you take creatine in any sports supplement and you ingest it and you go get your labs drawn, your creatinine and estimated glomerular filtration rate will potentially look bad. And the doctor says, you have stage 3 kidney disease. What? And then they have to come to me and I have to look at it and reevaluate it and say, are you taking creatine? Yes, I'm taking it every day. Of course the labs are going to look bad. So when you're looking at supplements, you have to understand the medical side. You have to really understand what you're doing, and creatine's excellent. Creatine's awesome. But again, I don't take it if I'm going for my labs for my doctor for about a week because I want my kidneys to look good on paper, right? So creatine, pre-workout, right? So I even take pre-workout because I'm still trying to bench the big money. I'm almost 60, trying to keep up there with the old guys that are strong too. So I take pre-workout. Look inside the pre-workouts. I mean, It's unbelievable. You'll need a PhD or you'll need to be Dr. T to understand what it is. So supplements are getting complicated, and now some of those supplements are very aggressive, right? They're stimulants, 500 milligrams of caffeine in it. I mean, and I'm, again, not against it, but you have to understand it's a supplement, but maybe it's going to be also a medicine. It's going to be very strong. So people are getting into their health. Supplements can help. There's so many different types of supplements. You should really read about them, understand them. It's not really my specialty. I'm a medical physician, but I have to understand the supplements for what they are. But in the end, so you have diet, exercise, supplements, your behavior, and then medicines. You see, that's the full spectrum. That's the full world. So diet, exercise, behavior, some supplements, and then don't hate on the medicines. Because if you need medicines, a lot of people are not taking medicines, obviously because there's a disconnect. And don't just take medicines. Have a good physician. That's why I created my app where you have access to me now for men that are on androgens on an app where you learn information and then you take that information and you bring it to your healthcare provider. Right, and even supplements can be understood. They can be potentially dangerous because you're masking something underneath. That's what you have to understand. I just want people to understand all that. So supplements are great, but there's an overlap with supplements and medicines. I want people to understand that.
So, as a former bodybuilder and as a doctor, when I speak about supplements, I differentiate them in 3 different classes. First of all, the supplements that are performance enhancing. There are standard supplements, creatine, of course, monohydrate, which is the most anabolic one, and potentially can increase creatinine because it's metabolized to creatinine, and then the GFR goes down. Now, the pre-workout formula certainly gives you a boost in caffeine, especially along with other stimulants that can be also potentially dangerous because they can give you heart arrhythmia and also an ischemic effect to the myocardium. And of course, we have a multivitamin, the whey protein, and the branched-chain amino acids pre-workout, leucine post-carb that kicks the mTOR, and glutamine is a very good supplement for recovery, even though it's not an essential amino acid. Now, speaking about prevention in medicine, of course we have medications, but we can use alternative supplementation to assist some medication. So there are certain supplements that don't work of course efficiently as drugs, but they can improve the lipidemic profile, boost the HDL like niacin or krill oil, lower the LDL like the red rice yeast, which is the plant-based statin. We have resveratrol also, which is an antioxidant. And we have also about the liver, we have the injectable glutathione, the DNA cysteine, NAC, and miltitol. Anyway, and as far speaking about the anti-aging part, we have a plethora of antioxidants and prohormones that can help. Personally, I'm using DHA, which is a supplement. I'm using pregnenolone, which is a supplement as well, along with my TRT regimen and other hormones as part of the HRT age management. And we have a plethora of other antioxidants dealing with the oxidative stress. Another thing we can take into consideration in blood work is the vitamins and some minerals that we can check it out. So which is vitamin D3. Actually, half of my patients are deficient in vitamin D3, even though in Greece we have plenty of sunlight. Vitamin B12, cobalamin, folic acid, and iron that deal with stamina and endurance. And mind that iron has to be always joined with vitamin C, which is a catalyst for the absorption. And that's all.
Awesome. All right, so I'm gonna just kind of step off the cliff here, guys. You guys mentioned some issues that we have going on right now in the world today when it comes to chronic illnesses in general. So we're like obesity, type 2 diabetes, PCOS for women, hypogonadism for men. Well, how do you guys see yourselves as practitioners and what you're able to do for these people with the 2 types of medicine that we're coming to? The reactive insurance paid for bandage medicine or the preventative care, let's take care of the problem medicine. How do you guys see yourself fitting in, taking care of these people?
This is a whole 2-hour discussion.
Another one. I figured we just might as well jump into it.
Well, unfortunately, it comes down to politics and economics. So the bottom line is, I think all of us try to practice as much science-based and evidence-backed medicine as we can. And I agree with what was said over here, that we try to start with the basics. I always start with the things that are free and that are easy and really outside the whole world of whether it's traditional medical care or new medical care, functional medical care, whatever you call it. Again, lifestyle, diet, sleep, stress, basic lifestyle parameters. Most of what we can get is from optimizing that. We have to put in the hard work. Everybody wants a quick fix, a magic pill. It just doesn't exist. So I always counsel my clients on all those things. Sleep and stress, number 2, like my 2 superheroes, the double S, is if you don't have that dialed in, nothing I give you or prescribe you is going to help you. Lifestyle, again, diet, food. What you can get from your nutrition is just as powerful almost as what you can put in your arm or your mouth as a pill. So dialing in that nutrition, your fitness protocols, and then going from there. But there's a lot going on right now, what Michael was talking about, and I think right now in the world of hormone therapy, I think we're all intimately involved with that. Fortunately, we're maintaining that. I think we all take care of a lot of men and women who have needs or hormonal deficiencies, which is unfortunately outside that traditional medical world. I think most of us, I know Tom and I came from the traditional medical world originally. Him and I and me in the ER, and it's a very different world. So the whole is still testosterone therapy, thyroid therapy, all the HRT stuff is still kind of outside the traditional world. It hasn't changed much for us as of yet. Who knows what will happen? As Michael said and Tom said, there's been changes. Starting to see things happening with supplements and starting things happening with peptides. I use a lot of medical peptides, and the FDA's kind of got that on a hatchet list right now to kind of remove a lot of those. Unfortunately, they're very safe and very, very clinically beneficial. But we've got, there's still a lot of them out there that I use, and I think we'll find new products and new repurposed medications to be useful to fill in the gaps.
Thank you, Dr. Fete.
That's perfect. I always love when he speaks first, so I can just get some good ideas and just pick up on what he said. All right, so obviously it's very interesting, right? So you look at, you look at this country, you look at obesity, and why don't we do anything about it? I don't know, political, yeah. It's such a huge problem because people like to eat, and there's a lot of food. So that's a problem. So people like to eat, and there's a lot of food, so that's a problem. In the end of the day, I've been on testosterone for over 30 years. I don't know about you guys, right? And look around here, so this is kind of a very special place, obviously, but outside in the world, more men are getting on testosterone earlier, and I think I'll talk about that for prevention, right? Because obesity and these things it's obviously very simple yet complex, right? There's a lot of moving parts to why people eat too much. Why do people eat too much? When they look in the mirror and they look at themselves and they don't feel good, right? As primary care doctors, we take care of people, they feel, it becomes this vicious cycle of just declination. They decline in depression, and they feel like they're weak and empowered. And this is why functional medicine doctors, which is not me, I'm not a functional medicine doctor. I'm an old-fashioned traditional doctor that just takes care of men on steroids and testosterone. And with me, I don't want you to have a heart attack. And I am great for not having a heart attack. That I could, everything else, I don't really know. But I can tell you this, testosterone in the world of traditional medicine, thank God I still have a medical license, right? So, because years and years ago, if you had a testosterone of 300 nanograms per deciliter, and you went to the doctor, and you said, that's 300 or 249, and I'm tired, a lot of doctors won't treat you. They won't treat it. I see guys nodding their heads. And even 20 years ago, when I was just a fresh doctor, 22 years ago, I was a resident physician in New York and working up in Connecticut, I was so paranoid, and still I'm paranoid, of course. I don't want to treat anyone who doesn't need testosterone, but look at it today with TRT clinics. And I'm not going to go on that rant against those places, right? But it's like, your testosterone, I call it the 400 club. Men come in, this is an amazing study, men come in to see me and their testosterone is 400. above 250, you're normal, but maybe they don't feel great. And of course, we try the diet and the exercise and the behavior changes, try to lose weight, but he doesn't feel good. Sex, libido is not there. And again, we've talked about depression, we've tried to see therapists, again, we don't want to push antidepressants, we don't want to do that. Doctors don't want to do that, but they have nothing else to give. So now, come to today, you give a man who's on low normal testosterone, right? He's in that lower quartile, right? You document that, you've counseled the patient, you don't want to lose your license. So, and then you say, let's do a trial of testosterone. This is prevention. Let's do a trial. See how you do. And the guy, obviously, you must have hopefully screened him that he doesn't have vascular disease, heart disease, refractory depression, prostate cancer, right? So you've cleared the guy, and now you're gonna give him, and he's not a steroid user, right? That's a whole nother subset of medicine, men that have utilized androgens, and now they have low testosterone from utilizing androgens. Forget that subset, but it's a big subset. Have you looked around? Business is good. In the end, you give men testosterone and you say, hey brother, and you don't have to be that low. And now my colleagues at UCLA and Cleveland Clinic, they agree. You're not a number on paper, but we're new. That's new now. We're new into this, and some doctors say, fully on you, it is a number. I'm not treating that patient. These are your doctors. But these doctors are overwhelmed, not because they're not smart, they're overwhelmed with this medical system. So give them a break. That's why you have all these TRT places. And I think it's good. I get upset with the TRT places because they give too much. Why is everyone on 200 milligrams of Cypionate a week? Why does everyone get the AI? Why does everyone get gonadorelin because you can't get HCG? Why doesn't everyone get, every man should get a calcium score if he's 30 or 35? Why do I have to pick up all these pieces? That's why I have my app. But at the end of the day, being on testosterone, if you understand the risks and you've maximized everything, and I don't want to see a 23-year-old guy on testosterone, that's a steroid guy who now has no testosterone endogenously, and he needs to. I saw a 20-year-old guy over here, he's on testosterone already. It is what it is. Now, you're 40-something years old, you're the average American bear, you're tired, you're exhausted, you've tried to do everything properly, and are you ready for testosterone from a prevention standpoint? We have no data that says it's going to prolong your life. We have the Travers trial that just came out, first ever randomized, double-blinded, placebo prospective run trial out of Cleveland Clinic. I talked to the doctor that ran it, and it looks like it's safe for men that are on, that have heart disease, that are on testosterone. But it doesn't mean it may not be safe for you. So screen yourself, know your ABCDs, hemoglobin A1C, B is blood pressure, C is cholesterol, cardiac, calcium score. Do something about it, because remember the guy that I told you he was in the 400 club and you tried him on testosterone? He feels awesome. He feels great. The problem is his sex drive is so high, it's not consistent with his wife. Don't be a wise guy. Don't be a wise guy. Don't wreck your relationship. That's a good problem to have, but I'm not kidding, by the way. And then you have to go through your ABCDs. So prevention, giving men testosterone preventatively early versus traditional doctors, they're not going to do it. They have too much on their plate. But I want you guys to understand that. So if you go to the anti-aging places, which is so ridiculous, imagine anti-aging when you're giving hormones? What the fuck is anti-aging? You want to anti-age, don't have a heart attack, get screened for colon cancer, skin cancer, mental health, and wear seatbelts. That's anti-aging. That's take care of your A, B, ABCDs. And you guys that are following me and you're on androgens, you know your ABCDs. You do it. This is the future. You're going to get information from me on telecommunications. You're going to get interested. I'm giving you evidence-based information from traditional doctors. It's what I do. And then, but it's fingerprint medicine. Everyone has a fingerprint. Don't take the same damn medicines that I take. They may be good for you, but they may not be good for you. So you need to be aggressive for your own health and take charge. And you will work with me, with your doctors. And you know what? America has a massive shortage of primary care doctors. Did you know that? We have and I don't know why our country, I'm not going to bash the country because we have enough problems in the world. What are we doing about primary care? They don't know what to do. There's not going to be, every day, every year, there's going to be less primary care doctors. You're going to have health networks already, and you're going to work with them. You need to work, you need to take care of yourself now. You don't get mad at some doctor that he or she didn't remind you to, they're overwhelmed. You need to take care of your ABCDs and do it yourself. If you're on testosterone, it can be awesome. You're never going to come off it. I want to make it clear. If you're on testosterone, the plan is, if the trial works, you're on testosterone like me forever. You tell that to young men, and they're going to go, whoa, 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 whoa. Not what I'm coming in for. I want to go, what do you think you're going to do, guy? Go on for let's get tuned up for a little while. No, you're not. You're never going to come off. Never. So that's just, but a lot of guys say, Doc, I want to be on, I love it. Now you don't want to have a heart attack. Right? So, ABCDs. Thank you, guys.
Thank you, Dr. O'Connor.
So I've been saying that testosterone is the wonder drug, and basically doctors don't like testosterone because it can reverse metabolic syndrome and obesity, including diabetes, and certain other diseases, so can it ruin the big pharma's incomes. So almost all of my patients that are obese and come to my office to read them the labs, all of them are low testosterone and develop elevated A1C. So in the absence and the deficiency of testosterone, the visceral fat increases, that leads to diabetes. And of course, more visceral fat can shut off the brain for more testosterone production. Now, if you take testosterone, you can burn more efficiently the fat because all the androgens burn the fat. That's why men are leaner than women. It also builds muscle. The muscle burns the glucose and reverses the diabetes. It can also lubricate the joints so it can reverse potential